Globally, an estimated 1 out of 2 children in developing countries has elevated levels of blood, elevated lead levels in their blood. And it affects, as Luigi mentioned, nearly 800 million children worldwide. Lead poisoning, especially in children, is devastating with irreversible effects. Lead exposure can lead to severe cognitive impairments, reduced IQ, and long-term health complications, with no safe level of exposure for children.
Ladies and gentlemen, we are committed to providing world-class paints. Our endeavor is to provide products that are not just best in performance, but also safe and minimize the impact on our environment. In continuation with the same objective, we converted the entire Duracoat and Duracoat Royal water-based decorative products to low VOC way back in 2011. And we continue to ensure that we provide paints that are environmentally friendly and good for our customers.
Lead poisoning exposure has detrimental effects, especially to the pregnant mothers, their unborn children. Remember, this hazard to the pregnant mothers can lead even to miscarriage, premature birth, stillbirth, low birth weight, and congenital malformations. The estimates from the World Health Organization indicate that lead poisoning accounts to 0.6% of the global burden of disease and contributes to approximately 600,000 cases of intellectual disability in children annually. These are not just figures. They are figures that could be alarming in the future. I have stated there is no point of reinventing the wheel. We must review laws, regulations, guidelines, and strategies to tackle the emerging chemical of environmental and health concerns, including antimicrobial resistance through a One Health approach. We have a duty and an obligation as Kenyans, and therefore, as a ministry, we will finalize and validate and disseminate the national policy on sound management of chemicals, lead poisoning prevention advocacy, legislation compliance, and enforcement in partnership with all of you as our key stakeholders and multi-sectoral committee. And equally, as the custodian of public health issues, we will develop the national strategy and action plan for the management of risks associated with exposure to lead poisoning and partnership with key players and everyone else. There's already a directive about replacing the asbestos sheets across the country. So what are we doing about this? How are we going to take care of while disposing this asbestos? It is important as a ministry, as a community, and as a consortium to be able to come up with solutions. You see, the minister has declared himself. The Ministry of Environment have already declared, but what are we doing about it? Because we must be part and parcel of the solution. It is not just about removing, but there's also that which can harm if they are poorly removed and disposed.
According to the doctor,
yes,
she just said that she had, there were traces of lead poisoning in her blood. So some of the effects of lead could be miscarriage, just like your wife just had.
How did lead traces get into Aisha's blood?
Could you by any chance be working near an industry of some sort?
Yeah, I work at a battery acid industry.
Yes, so if Aisha came into contact with your clothes, or either through other methods, but mostly through your clothes when she's washing them, she could get the lead poisoning, which could cause the miscarriage.
It is estimated that lead exposure costs the global economy $1.4 trillion annually. And I think this morning we were talking about that number could be an underestimate. It contributes to over 1 million deaths each year. Kenya's primary sources of lead contamination include informal recycling of lead-acid batteries, e-waste processing, industrial emissions, and the use of lead-based paints. While there have been multi-sectoral efforts in Kenya to adopt important lead paint and other regulations, there's still much work to be done to strengthen, monitor, and enforce regulations.